Hey students, this is Dr. Gonzalez. I hope you're doing well when you're watching this video. And you know what? Let's just go ahead and get started with the following topics for today. Around the pharynx, we're gonna have a couple of muscles, which are constrictor muscles. These are gonna form an external structure, forming a muscle layer, predominantly circular, and there's gonna be three constrictor muscles. There's a superior, middle, and inferior. Here's the superior pharyngeal constrictor. Here's the middle pharyngeal constrictor. And here's the inferior pharyngeal constrictor. They are arranged like a stack of three glasses. Like I said, the superior constrictor is partly overlapped by the middle constrictor. And this middle constrictor is partly overlapped by the inferior constrictor. These are going to constrict the pharyngeal wall during swallowing to help propel the bolus of food downward to the esophagus. Now we also have some muscles that are longitudinal muscles that form the internal muscle layer. First, we're going to have the stylopharyngeus, which is this muscle right here. We're also going to have a palatopharyngeus, which is this muscle right here in blue, also considered a muscle of the soft palate. And there's also a salpingopharyngeus. And these muscles, what they do is they elevate the pharynx and the larynx during swallowing and speaking. Now let's go into a little bit more details of these pharyngeal muscles. First, we're gonna go over the superior constrictor. This one has an origin in the pterygohamulus and the pterygomandibular raphe, and the posterior part of the mylohyoid line of the mandible. The insertion is the fibers that pass posteriorly and medially to meet the fibers of the superior constrictor of the opposite side in the posterior midline. The uppermost fibers are going to insert into the pharyngeal tubercle of the occipital bone. The lower part of this muscle is going to be overlapped by the middle constrictor. The middle constrictor has an origin in the greater and lesser horns of the hyoid and the lower parts of the stylohyoid ligament, the ligament that extends from the styloid process to the lesser horn of the hyoid. The insertion is going to be the fibers that are going to be passing posteriorly and medially to meet the fibers of the middle constrictor of the opposite side in the pharyngeal raphe. The upper fibers are going to overlap the superior constrictor, and the lower fibers are going to overlap the inferior constrictor. And the inferior constrictor has an origin in the oblique line of the thyroid cartilage over here, and a lateral aspect of the cricoid cartilage, which is more inferior. The insertion of the inferior constrictor is the fibers that pass posteriorly and medially to meet with the fibers of the inferior constrictor of the opposite side in the pharyngeal raphe. And the upper fibers will overlap the middle constrictor. Now the stylopharyngeus has an origin in the styloid process. And insertion, these fibers are going to pass inferiorly and medially, and they enter the pharyngeal wall by passing between the superior and middle constrictors. Some of the fibers will insert into the posterior border of the thyroid cartilage over here, and the rest of the fibers are going to terminate in the pharyngeal wall with the fibers of the palatopharyngeus. Now the palatopharyngeus has an origin in the posterior border of the hard palate and palatine aponeurosis. And the insertion, these fibers are going to descend in the lateral wall of the pharynx, forming the palatopharyngeal arch, and some of the fibers insert into the posterior border of the thyroid cartilage. The remaining fibers are going to terminate in the pharyngeal wall. And lastly, the salpingopharyngeus, which is a muscle that has an origin in the cartilage of the auditory tube near the tube's pharyngeal opening, so that's gonna be over here. And the insertion, these fibers are going to descend, forming a salpingopharyngeal fold, and they blend with those of the palatopharyngeus. Now, if we take a look at it as an overall, we have gaps between the constrictor muscles, and between these muscles there's going to be certain structures passing through them. So the structures passing through the gap between the superior constrictor, which is the muscle you see right here labeled in baby blue, and the base of the skull is going to be the pharyngotympanic tube, which is this structure right here. We also have the levator veli palatini, which is a muscle of the soft palate, and the ascending palatine artery. There's also going to be structures passing through the gap between the superior and middle constrictor. Here's the middle constrictor, such as the stylopharyngeus muscle and the glossopharyngeal nerve, which is this nerve right here. And there's going to be structures passing through the gap between the middle and inferior constrictor. Here's the inferior constrictor and the middle, such as the internal laryngeal nerve and the superior laryngeal vessels. These structures passing through the gap between the inferior and inferior constrictor now is going to include the recurrent laryngeal nerve and the inferior laryngeal vessels. Here is the recurrent laryngeal nerve. And if you want to learn more about this information, click on the video here at the top that is suggested for you. And that is it for today. Don't forget to like and subscribe if you're liking what you're watching, and I'll see you on the next one. Thank you for watching. Bye.